Good afternoon, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stein. I'm Chief Medical Officer and Family Physician here in Vincennes, Indiana. Joining me as always, Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We're going to be giving you a brief update today on status of COVID in our community, and then going back to what this is preferentially to be, which is more about subject topics and things every few weeks or so. And we're going to talk a bit about preventive medicine, primary care, so forth. So just kind of lead us off. General numbers, about 10,500 cases since the beginning. But again, we always go back to what those positivity rates are. And the positivity rates have been incredibly high over the past several weeks or so. Last set of numbers, the 15% for all positive and 48% for unique individuals, which is absolutely incredible compared with what we've seen over the course of the past couple years. Important thing to note, though, is that although the numbers are still very high, there's lots of active disease in the community, the consequences of that are not nearly as bad as what we saw even as recently as a month or so ago.
Yeah, we've seen hospitalizations decline pretty dramatically over the last 3 weeks, greater than a 50% reduction in where we were with hospitalizations to where we sit today. And who would have thought we'd be sitting here talking 48% positivity rate is an improvement from where we were weeks ago. But as you mentioned, the clinical impact, the number of individuals needing treatment, needing hospitalization has certainly sharply declined since late third week of January, late January, and that trend continues to look promising as we go forward. And so certainly as we've got some warmer weather and things start to move in that direction, we're hopeful that we'll be able to sustain this lull in the number of hospitalizations and individuals that are needing outpatient therapy.
And when we talk about types and variants, we always come back to the fact that this last round that we've had with Omicron, highly, highly contagious, probably the most contagious variant that we've seen, less virulent, less lethal, less morbidity and mortality. And that's sort of a blessing and a curse all wrapped into one. The good news is when we go back to the beginning of all this and talking about the terms that all of us got introduced to the public as far as public health measures and herd immunity and so forth, there's a few ways to achieve herd immunity. Number one is through vaccination and trying to get a high enough percentage of the population that can't catch it because of that active immunity. And the second way is that everybody catches the disease process. And we have been marching towards that all along. But one of the ways in which the infectivity of Omicron has helped us is it has gotten nearly everybody infected one way or the other. The good news is those that have been vaccinated, less severe illness, shorter course of illness, continued improvement in immunity. And so what we hope to see happening as this continues to evolve, which it will over the course of our lifetime, is that we will hopefully see continued less virulence, but probably still continued infectivity.
Yeah, I think one important piece is, a lot of times we get the question of when will this be over and when will coronavirus be gone? Never. We expect for our lifetimes that there is going to be this transition to endemic and that there is coronavirus around. And there's also been various forms of coronavirus. Common cold is a form of coronavirus that have been around well before this. We saw this novel version was leading to hospitalization and death, and certainly had to take some of those actions that we did early on. But feel pretty confident that from a medical scientific standpoint, we're in a place that we're seeing less virulence, high transmission, of course, but it's something that we can live with, and we are figuring out how to live with, and that certainly is that's promising.
Yeah. And a lot of things are being reevaluated, reestablishing what new guidelines are. Masking precautions are being pulled back. I don't know that we'll ever see the day that we're not doing that. I would look forward to it. But most of the things are relating to how we look forward, what things are going to look like in the future. And a lot of that continues to soften. There's good data behind a lot of that. And then also looking forward to the next fall, which presumably we will get back into our normal cold and flu season again. And part of normal cold and flu season is going to be, unfortunately, what we see with COVID. Right. And what we anticipate will be the case with that is routine vaccination, just like we do with our influenza.
Sure, we really do expect that to start to follow influenza. And when we talk about COVID and influenza in the same regard, and there's comments of, well, it's just another flu, keep in mind, we have become accustomed to living with the flu. And so we somewhat downgrade that to it's just the flu, it's not something to worry about. But there are tens of thousands of individuals every year in the United States that die because of flu. So there is still an inherent risk to any virus. Certainly anyone who has chronic conditions that would weaken their immune system, have older in age that their immune system is weakened. It really gets back to how well can your immune system fight the virus, because if your body can't ward that off, then in all likelihood you're going to be susceptible to becoming very ill, and some people will not be able to recover from that. But again, we're in a place that's becoming less and less, and through a robust vaccination, whether that will be annual, whether that will be on every few years, whether we'll get to the point from a technology and scientific research standpoint that there truly is a vaccination that puts an end to coronavirus, that's way down the road. When we look at the positive things that have came from the pandemic, certainly the rapid approach from a technology standpoint with mRNA vaccinations has been tremendous. We expect that will change the vaccine world going forward forever. And treatment modalities that we have seen with monoclonal antibody and just some of those advancements that in all likelihood otherwise would have been decades behind are now promoted forward. And really we're seeing the landscape of healthcare change pretty dramatically to be able to take care of patients in a different way.
Yeah, and the other thing that as we've kind of gone through this is that rapid response and availability ramping up and ramping down of testing, treatments, visits, so forth. We've seen unbelievable changes just over the course of the past couple months in how busy our convenient care, ER, and primary care offices have been in the big spike and then slowdown. And right now, testing is readily available, visits are readily available. The treatments, interestingly, kind of came late on the backside outside of monoclonal antibody. We were very fortunate that monoclonal antibody came out as quickly as it did and was successful as it was. Some of the later coming treatments, great availability of those now. Fortunately, what we have seen is because the variant is not as severe and the cases are coming and going more rapidly, a lot of that is not as necessary as what it would have been even 6 to 12 months ago.
Right. And as we look really at the treatments, a lot of questions come up as why do treatments come about so far down the road, and so much focus was put on prevention. So prevention through robust vaccination, and that was where the immediate efforts went to, because if we can prevent something, we don't have to treat it. And vaccination being a key element of that, which really turns into what we're talking about going forward. And COVID has had such a dramatic impact beyond the virus, beyond COVID. It has impacted individuals feeling comfortable going to healthcare and getting care for diagnostic care, for emergent care. And before all of that, we talk about preventative medicine. And as a family physician, that's something that you specialize in, is that preventative side of thing. And it's not just an apple a day. There's a little bit more to it, I believe. So as we start to feel we're in a place from a COVID pandemic standpoint to really promote preventative medicine, there's a checklist per se that you follow, that your peers follow, and I'd like for you to speak a little bit about how you engage your patients in preventative medicine and staying healthy, staying out of the hospital, because once we get to that treatment point, sometimes we can't come all the way back from that.
Yeah, absolutely. Really what we thrive on in primary care, and that is family medicine, internal medicine, pediatrics, and obstetrics and gynecology to some extent, is trying to prevent a disease or a process before it starts. It is much more effective, it is much safer, it is much less expensive to the patient to prevent a disease until we wait until something happens and then have to start bailing water. So really, there's a key set of guidelines that we all kind of base everything on. The U.S. Preventive Services Task Force is something that we all tend to prescribe to, paying attention to what those recommendations are because they're very evidence-based. We follow these guidelines, and I have the most current list that is updated really every few months or so with the recommendations that we consider the most solid. Those are what are called the A and B recommendations, and those are things that if you got 100 doctors in a room and got them to talk about it, they would nearly all agree on that. When we get down into some of the other recommendations, it's more consensus and opinions, but everything that we'll talk about today in the A and B recommendations are things that pretty much everybody in the world of medicine and evidence-based medicine will agree is important. So primary prevention is getting in to see your doctor, your primary care provider, generally on an annual basis. And this is something that we encourage throughout life. So obviously in the before you're even born, we have prenatal visits every month, then every 2 weeks, and then every week towards the end of pregnancy as a preventative issue. Then once children are born, we get them in to be seen every 2 months, every 3 months, every 6 months. Where things tend to fall apart, specifically with us guys, because women are much better about going in for preventive visits, is in the post-adolescent phase when people go from 18 years old up till they first have their heart attack at 50. Us guys kind of fall off the map. And so really what we try to encourage people is in that interim period when disease processes are forming, that's the time to get in to see your primary care doctor. That's the time to go in and do what we kind of review as a health review. So going through all your health history, not specifically just that your leg hurts or you have toenail fungus or you have an ear infection, but those things that we should look at every year. And this is something that crosses over not just in the medical world, but in the eye doctor world, in the dentist world, is that all of these type of preventative things, if we take action early on, that keeps you from getting those diseases.
And when we put this in terms from a community standpoint, you have multiple pages of the various recommendations. They can be age-based, they can be male, female, family, risk. It's quite a list to try to keep track of. I mean, just hearing you say that 18 to 15 post-adolescent, I was confused because my wife still tells me I'm an adolescent all the time.
Yep.
So now I'm not sure which one to follow. But it's not too different in how we maintain other things. I mean, we do maintenance on our computers, we do maintenance on our cars, and it is preventative maintenance. So we live that in a lot of our daily lives as you do this up front to avoid a bigger concern going forward. So I don't have to keep track of this. I don't have to put on my calendar, hey, I just turned 40, I need to look at colonoscopy and this screening and that screening. It starts with having a relationship with a medical professional, physician, and how do you manage all that? Because now you take that and you've got 2,000, 3,000 individuals that you're trying to manage all that. So do you just keep that written down on a little piece of paper?
Yeah, thankfully we've harnessed technology, and it used to be it was just a checklist, a paper checklist. And the important part about that is you need to have an established relationship with a primary care doctor. And a lot of people will think, well, I go see my doctor when I'm sick, but no different than rotating your tires and scheduled oil changes and scheduled maintenance. It's important to do that preventative on a routine basis. Now, in general, in the primary care world, we encourage people to do that during the healthy times a year. So it's okay to come in for a preventative visit in January, but really the ideal time to do that is typically from about May until October, when there aren't a lot of disease processes going on. That's ideal for school-age kids to come in during the summer months to have a wellness visit, sports physical type visits, for adults to have wellness. They're not as busy. But that visit is very important because it's during that visit that you bring us information. So let's say you went to a health fair somewhere and you had some labs done, or you had some screening tests done, or you had a vaccination at our pharmacy or a local pharmacy. You're giving me that information. I'm putting that in our system and updating it, running it through this list of things, and then giving you information back to say, hey, it looks like maybe you've gained a few pounds during COVID. It looks like your blood pressure's up a little bit more. It looks like your depression screen is through the roof because it's been COVID for the last 2 years. But all of these types of things are part of what that screening process is of going through what would seem like kind of an exhaustive list. But once that list is formed, then we have that in our system, and then believe it or not, you've got it on your smartphone. And through MyChart, we encourage people to participate in MyChart for a lot of reasons. But one of the big things is, just like your car tells you when it's due for an oil change, your MyChart account or your email account through MyChart will tell you, hey, Adam, you're due for your tetanus. It's coming up due for that. Hey, you'll be due for screening for diabetes within the next year. You have a colonoscopy that will be due up this next calendar year. So that helps us as clinicians to make sure your data is up to date. Therefore, the electronic medical system is alerting you and us as to when that's necessary. And this applies to everybody from our childhood vaccination status all the way through up the cancer screenings that we do.
The MyChart plug is a great one because you look at that and you see the green check, the red X that says you did it or you didn't, and we're all inherently have a little bit of competitiveness of this is my profile and I want everything to be complete on it. So if I haven't had a well visit or haven't had immunizations that are recommended or screenings, then those all show up and they can help me to manage those and then have a conversation with my physician to say, is this appropriate for me? What does it entail? Another element that we talk often about is the cost of healthcare. And certainly during the pandemic, there's all kinds of discussions about how healthcare is reimbursed and those costs. One big benefit of preventative medicine is that most insurers do cover this with very little to no out of pocket for your patients.
Absolutely. One of the things that people sometimes don't understand is nearly all health insurance, since the Affordable Care Act came around, covers preventative services. And again, they are all lined up with this, which is a government recommendation-based organization, to a lineup that say that not only should you have a colonoscopy starting at age 45, not only should you start breast cancer screening between ages 40 and 50, not only should you have certain vaccinations, but those things are required to be covered by your health insurance. And so what a lot of people don't understand is this visit that we're talking about is generally covered with no copay through your insurance. And then the services that are recommended associated with that are preventative generally are also free, because not that insurance companies are horrible entities. They do what's best for us, but in their mind and in our mind as well, we spend less money taking care of prevention that keeps the disease from happening. Although a colonoscopy may cost a few $1,000s, a colon cancer may cost $150,000. So it's important for your health. It's important to your insurance company that you get it done. And so they generally cover all of those type of preventive services of screening for cancers, screening for hypertension, cardiovascular disease, and immunizations, generally at no cost.
And so I'm listening to the preventative medicine. I know I don't have a physician that I already have an established relationship, and we've kind of talked. That's step one. So how do I now get engaged with a physician that's close to Vincennes, Knox County, whomever is listening, and kind of start that process?
Yeah, so generally you want to find a provider that you're comfortable with. So, in family medicine, we generally take care of the pregnant mom, the newborn baby, the teen and adolescent, the grandma, the grandpa, so forth. Other people specifically want to hone in, let's say that you have a child that has chronic medical problems. You might be more comfortable seeing a pediatrician for preventative type health services and for acute care type services. People who have more complicated medical histories, congestive heart failure, chronic kidney disease, certain types of cancer syndromes, may be better served by an internal medicine physician acting as their primary care provider. Or, as we said, women generally do very well with preventative care. They're established. They know that in the past they were supposed to go in and get an exam and a pap smear every year. That recommendation has now changed to every 3 to 5 years. But staying established with an OBGYN who acts as their primary care provider can make those recommendations to them. But the whole idea is finding somebody that you're comfortable with, that you can communicate with. And if you don't have somebody already, then our Find a Provider line through the hospital can help direct that. You as the patient, though, should make sure that you're vocal about what your preferences are, because when we talk about how you match up with that, we want to make sure that you get the appropriate level of care for what your disease process would be.
So I think our Find a Provider line, certainly our website, and there is a consumer-driven element to this of shopping and making sure it's a good fit. And so we have star ratings and comments and all kinds of things that our website helps to facilitate so that you can find the provider that you feel the most comfortable with. And then it starts with make an appointment, have the conversation. And a key piece that you mentioned in talking about the different patient populations, this isn't preventative in the terms of I have to be healthy and prevent it. If you have one of those, chronic heart failure or hyperlipidemia, high blood pressure, doesn't mean, well, now I'm precluded from all of that because I'm not an otherwise healthy individual. You're still healthy, and we're looking at a very broad spectrum of preventative diseases, from cancer screening to those, nutritional, hypertension, hyperlipidemia, heart failure, all kinds of things that we're looking at. So really every patient should be having a conversation in establishing a primary care physician and seeing where they're at in their terms of health from a professional standpoint moving forward.
And this also crosses over all different modalities from medicine, dentistry, ophthalmology, optometry. Many times people won't go see an eye doctor unless they need a prescription or they need their contacts filled. But routine eye screening, especially in the young population, that's one of the USPSTF guidelines, is in the going into school age child that they should have vision screening done. And while I can do a vision screening in my office, I feel that it's a very compelling argument to go and see an optometrist or an ophthalmologist to get a good screen for what we call amblyopia, which is a wandering eye or a lazy eye on one side or the other, make sure that vision correction is good, and also check pressures in eyes, look for other disease processes. Of course, my wife being a dentist, I got to plug the dental side of things. That's also a USPSTF guideline, is that young children in that preschool and permanent teeth coming in age era, recommendation is to get screened, to get fluoride supplementation, and then also to get varnishes applied. That's actually a 2021 recommendation that came out, because that has now proven to be incredibly preventive in that early population in preventing dental caries. So again, it's not just us within the medical world, but in the dental world, the vision world, and so forth, is to make sure that these folks are getting in for those preventive services as well. Because many of these disease processes that we talk about preventing are asymptomatic. Hypertension screening, asymptomatic. Early diabetes, asymptomatic. Glaucoma, asymptomatic. Dental caries, asymptomatic. Vision deficiency causing difficulty in school-age children, asymptomatic. So many of the things that we talk about in preventive medicine don't have symptoms. So if you wait until you're pooping blood, that's a bad sign. If you wait until you notice that your child's eye is drifting to one side and they had a vision correction that could have occurred, that's a little bit on the late side. So all of these things that we talk about and the USPSTF emphasizes is there's a tremendous impact by acting early.
Absolutely. Very, very good points, and certainly preventative medicine first as we move to diagnostic care. You know, we've kind of passed over to now we know something is going on that needs to be addressed. And again, cost-conscious consumers for healthcare, that also is going to become much more expensive as we look at diagnostic treatment versus preventing something on the front end. So thank you for all of the information, and I think we covered a little bit of COVID and preventative medicine. So we'll see if we have any questions that we can address before we get off of here.
Hot topics.
Yeah, there was a COVID question. Somebody made a comment that they heard the booster is just lasting about 4 months. So wondering how often this booster or boosters would be required or recommended.
So the straightforward answer is to be determined. When the boosters from a recommendation and data standpoint were coming out, it was a pretty much an assurance that 90 to 120 days of the 90+% efficacy. And then it does start to wane, but how fast it wanes depends on your immune system. And there are also the external factors that we really can't predict, such as new variants. If a new variant were to emerge that were more evasive to the vaccine, we could see that efficacy fall off pretty dramatically, which would really have nothing to do with the individual boosted, right, but more the external environment. But 90 to 120 days, we're looking at that 90+ protectivity, and then it does start to wane off. And very similar to those that are at risk, the efficacy waning pathway really follows age, your immune system from any chronic diseases, and just how much your immune system has been able to take that vaccine and create protectivity.
And just like Adam had spoken about earlier, this parallels what we do with influenza. So when we look at influenza vaccination, each year they look at what the virus strain is overseas. The new vaccine is produced. It's generally released in September timeframe. We start the vaccination program then. Vaccination peaks within a few weeks, carries people through the winter months, then wanes as the following year comes. And we start all over again. And so this is the exact same type of parallel when you spoke of seasonality. That's what we expect will be happening with COVID also. Yeah. And believe it or not, in pre-19 era, COVID was here in a whole variety of viral upper respiratory forms and was not that significant. And that's what we anticipate turning back to, because we don't vaccinate for para-influenza and rhinovirus and Coxsackie virus and all these other things. Those are the viruses that live around us all the time. The thing that made this unique and novel was the fact that it had a high lethality rate. And compared with influenza, that's basically what got us in this mess in the first place.
And I think it's a fair scientific estimate at this point to say that seasonality in all likelihood will mirror somewhat closely influenza in the fall, winter, colder seasons, because things move indoors, viral replication and transmission goes up, whereas as we move outdoors and sunshine, which is a natural killer of the virus, and we're more spread out, tends to be the lower. So if that does happen, when we talk about preventative, you and I have talked, we certainly see that at some point COVID, flu vaccination could be on the same time frame, be able to address both viruses on the same time frame. So I look forward to those days when we get there and we have a seasonality, and it mirrors that. So we're kind of just dealing with the viral season rather than the COVID season, the flu season, and such.
And another question, kind of comments. So if somebody needs to see their primary care provider and they can't get in whenever they need to get in, what are those alternatives for that patient if they feel like they're not getting in as soon as they should be?
Sure. So a couple of things that we talked about. Most of what we discussed today as far as preventative, again, is something that can be planned ahead. There's generally not an urgency to it, and we would prefer that those folks look at that in our healthier months of the year. As far as getting in to see primary care, obviously the volumes that we've seen over the course of the past couple of years, unbelievable. I would say we've played catch up pretty well in the last few months, and the availability for primary care is better now. We're very fortunate to have started residency programs here in psychiatry 3 years ago, internal medicine 2 years ago, and so the primary care access has improved as a result of that. Our volumes and availability through convenient care, that's been expanded from not just our convenient care out on Willow, but also convenient care through Williams Brothers Pharmacy by Harold's JC. All of those things from an acute standpoint, if somebody says, hey, I just can't get in to be seen today, I'm having some difficulty breathing, I've got an infected toenail, what do I do? The answer is, please don't go to the ER. Our ER is busy and needs to be taking care of our emergent patients. The majority of the time we can get those people accommodated, whether they are adult, pediatric, or otherwise, in our own primary care offices, in our internal medicine residency, or through our convenient care services.
Yeah. I think it starts with a phone call or a MyChart message requesting appointment to your provider, and then the provider will assess based off the information, or somebody from the office will call you and assess, do you need to be seen today? It's something that you shouldn't wait, sounds not emergent, go to the ER, but relatively urgent, and then they will work to either get you in on their schedule or a peer schedule. We have a single record EMR, so if a peer of Dr. Stein's and you're a Dr. Stein patient sees you, he will be able to see that information and then follow up. And then they may say, I have an opening in 2 days, and that would be appropriate. So it starts with that phone call, and then let the medical professionals look at it and kind of guide you in what is and what is not appropriate. One thing that certainly, we point a lot of things to the pandemic, but technology has moved forward, and staying at home and ordering things online that then show up within a day. We want pretty much instant solutions and instant response to the things we need, but we also have to recognize that there is an appropriateness to that, and so it starts with that phone call message, and then we'll help to guide the care to make sure that it's delivered timely. All right. Well, thank you, everybody, for tuning in today. I hope this was informational, and take time to engage with your primary care provider and learn more about preventative medicine. Thank you, Dr. Stein.
Thank you.